opioid epidemic, chronic pain, and solutions other than drugs is what we're talking about here. In the book, A Nation in Pain by Judy Foreman, she reminds us that there are about 238 million adults in the United States. Adults, half of them, 1 of 2, has chronic pain. And the number one source in the body for pain is the lower back. More on that in a moment. So we're going to talk about solutions. There are so many great tools that we all have to prevent pain from happening and to be sure that if you have pain, to try to knock that down and maybe remove it. The first one we've talked about in other shows is omega-3 fish oils. This is from an article, American Association of Neurological Surgeons. High-dose omega-3 oils used to treat non-surgical neck and back pain. So here's chronic neck and back pain people, but they're not surgical candidates. Investigators at the University of Pittsburgh have treated chronic pain patients with high doses of omega-3 fatty acids. The ingredient found in many cold water fish species such as salmon, mackerel, herring, sardines, and anchovies. The researchers say their findings suggest that this could be the answer to the adverse effects seen with non-steroidal anti-inflammatory drugs, or NSAIDs, which are aspirin, ibuprofen, Advil, Motrin, Aleve, and so forth, all of those drugs. Dr. Joseph Maroon, neurosurgeon and specialist in degenerative spine disease at the University of Pittsburgh, reported the findings at the 73rd meeting of the American Association of Neurological Surgeons. Patients who took high doses of omega-3 oils were impressed enough with the outcomes that they chose to continue using the oils and stop their non-steroidal anti-inflammatory drugs. That's impressive. So people that were already taking drugs, already had chronic pain, they started taking fish oil, the improvements were enough, they stopped the drugs. 250 patients suffered from chronic neck or back pain but were not surgical candidates. After just 75 days of taking high doses of omega-3s, 59%, call it 60, so 60% had stopped taking prescription drugs for their pain. That's a huge number. 88% said they were pleased enough with the outcomes that they plan to use fish oils. Go to my fish oil show if you haven't seen it to talk about doses, brands, which ones to buy, and so forth. Number 2 on our list is chiropractic. Chiropractic being the leading alternative care provider in the country and growing around the world. This study here, the prevalence patterns and predictors of chiropractic use among the adults, the results from the 2012 National Health Interview Survey. The data was collected in 2012, but it takes time to assess the data. It's now been published in December of 2017 in the journal Spine. The aim of the study was to investigate lifetime and 12-month prevalence patterns and predictors of chiropractic utilization in the U.S. There's a growing trend of chiropractic usage over the in 10-year period from 2002 to 2012. Chiropractic uses manual therapy to treat musculoskeletal and neurological disorders. Back pain and neck pain were the 2 most common reasons for chiropractic consultation and for the majority of users. A substantial portion of the U.S. adults utilized chiropractic services during the past 12 months. The numbers are 55 million adults in the United States in a 12-month period have been to a chiropractor. That's a huge number of people. Most respondents reported, and this is really good news, consulting a chiropractor for general wellness or disease prevention, 43%. To improve their energy, 16%, or to improve athletic or sports performance, 15%. Out of that 55 million, that's huge. Many respondents reported positive outcomes of chiropractic utilization, agreeing that such care has helped them improve overall health, to make them feel better, 67%, to sleep better, 42%, and to reduce stress or relax, 40%. I mean, these are wonderful numbers. Just talking about the general population and the huge number of them using chiropractic because of pain. Our analysis shows that among the U.S. adult population, spinal pain and problems, specifically back and neck pain, have positive associations with the use of chiropractic. Imagine if we take that group of people, 116 million adults that have chronic pain, and say, let's get you on fish oil. Let's get you with chiropractic. We know that a better nutrition plan will decrease chronic inflammation and chronic pain. Let's get people on something that's been successful for centuries, like a Mediterranean diet, high in vegetables, good healthy fats, smaller amounts of meat, real food that's grown around you, organic when possible, non-GMO when possible. Do the best job you can. Go higher in vegetables, lower in fruit. Just make sure it's real food. The consistency across the board, whether you're a vegan, vegetarian, heavy meat eater, paleo, primal, Atkins, whatever in this side, or something Mediterranean in the middle, why these work when people do them all is the fact that they're just eating real food, getting away from processed food, getting away from sugar, no soda, no diet soda. Remember, just eliminating diet soda has knocked down people's pain, chronic pain as well. No juice, no fruit juice, no sport drinks unless you're some sort of an athlete. None of those things. That dietary thing can be huge for people. We know the exercise thing, so daily physical exercise should be your goal to your physical abilities. Check with your doctor of what you can, but we know when you move your body, you're firing those special nerve endings, those motion nerve endings that directly inhibit pain impulses from getting to the brain. And of course, reducing stress and getting enough sleep. So getting some stress reduction methodologies in your life. I've talked about this on this show. You can go to my website to learn about that. And enough and regular sleep, trying to get to bed approximately the same time every night, getting up approximately the same time every day, can be huge for you. Look at all these tools that we have to battle chronic pain, fight the opioid epidemic, reduce the consumption of pain pills. I'm Dr. Scott Fuller.